Kia ora koutou katoa, and welcome to today's update on COVID-19. There are 78 new cases of COVID-19 in New Zealand being reported today, and this is comprised of 73 new confirmed cases and 5 new probable cases, and that is as at 9:30 a.m. this morning. More details or information on these cases, including the probable cases, will be provided via our website shortly and updated as new details emerge. We will also be moving to provide information about the age and gender and geographical distribution of these cases, the latter as a map on either our website and or the COVID-19 website. There are 27 individuals that we can confirm have recovered from COVID-19 infection. Currently, there are 7 people in hospital and all are in a stable condition. 3 are in Wellington Regional Hospital, 2 in Nelson Hospital, and 1 each in Waikato and Northland Base Hospital. None are in intensive care. Our laboratories are continuing to work hard to process and report test results quickly. Yesterday, 2,417 tests were processed around the country, and so the total number of tests processed to date is 12,683. The average number of tests over the last 7 days is around 1,400. A reminder that anyone who has been tested is expected to remain in strict self-isolation, that is, isolating themselves even from those people in their own household until the test result is available. Public health staff and Ministry of Health staff are actively following up all close contacts of each case. In terms of our new cases today, the majority still have a link to overseas travel, including being in the same household as someone who has returned from overseas, or they are the close contact of an existing confirmed case, or they are part of a known cluster of other cases. At the moment, we are investigating several possible clusters. As yesterday, there is the Marist College in Auckland and the World Hereford Conference that was in Queenstown earlier this month. There is also a number of people who were at a wedding in Wellington recently, a group of people who were part of a trip to the United States. There is also a group that appeared to be associated with contact from someone who was on the Ruby Princess and that cruise ship, and that group is in Hawke's Bay, and will be messaging out from the District Health Board around that, the local public health unit, about people who may have been in places where they may have been exposed to that person, because we want to identify them and ensure they are taking appropriate measures, and also a rest home in Hamilton. I don't have any further details about those clusters, but we will be providing information on them on our website. So in summary, the combined total of confirmed and probable cases in New Zealand today is 283. On the topic of personal protective equipment, it's important that our health workers and also people working in essential services, at least some of them, are able to access PPE. So we have a number of measures in place to ensure that PPE equipment is available for those people. It is already available for a range of health workers, and we have a separate stream of work to ensure there is a supply to essential workers, for example, staff in supermarkets, and that supply is continuous for the period that we are in the current arrangements. An example for the DHBs, we're releasing 600 masks later today to District Health Boards from our pandemic stock. We know that we have good production of masks onshore at a rate of more than 200,000 to be produced each day, so we are making sure that there is a steady flow of that equipment, both masks and other PPE, to our District Health Boards. I also want to just announce on behalf of Pharmac a change to the pharmaceutical schedule effective from 11:59 p.m. this evening. And this relates to ensuring that all people can access the pharmaceuticals that they need over the coming month. We have seen some stockpiling, unfortunately, by people. There is no problem with the supply chain at the moment, but we do not want to get into a position where some people are unable to get the pharmaceuticals they need because others have them stockpiled at home. So, from later tonight, pharmacists will be required to limit dispensing of all funded pharmaceuticals to 1 month's supply or 3 months' supply for oral contraceptives. Pharmacists may use their discretion in implementing this more immediately today. There is no change to the way prescriptions will be written, and people won't need to visit their prescriber more frequently. It is simply a change to the amount that is dispensed at each visit to the pharmacy. And this is indeed to manage medicine stocks and ensure our supply chains are robust. There is no significant shortage in any area at the moment. Once again, as with the current arrangements that Pharmac announced a few weeks ago, pharmacists will still be able to make exceptions on a case-by-case basis. For example, where people live remotely and it's harder for them to access the pharmacy, or where they have mobility issues, so it's a challenge for them to get out. And many pharmacies are now in the process of, if they haven't already, organising home delivery of pharmaceuticals. So my final message before I hand over to Mike Bush to update you on some matters is just to reiterate some key messages. These are unprecedented times for both this country and indeed people around the globe. We are all in this together, and we will expect the number of COVID-19 cases in New Zealand to continue to increase over coming days and for at least 10 days. If we all do our bit and help to break the chain of transmission, that number will start to decline and we will be able to get on top of this. So I just urge all New Zealanders to continue to do their bit, and of course, as ever, look after yourself and look after your friends, your family and your community. Kia ora, Mike, over to you.
minutes away from one. Simon Barnett and Phil Gifford. It's the hour, thanks to General Finance, trusted by New Zealanders since 2001 on News Talk ZB. Joining us from thecountry.co.nz, Ro in a Dankin. G'day, Ro. Hello, Ro.
Hi.
How's it going today?
Oh, well, it was a really easy commute into work yesterday this morning. Not a lot of people around, but yeah, it's a surreal feeling, isn't it?
It certainly is. It certainly is. Hey, look, I wonder how are rural schools coping with all this?
Yeah, well, I can't speak for all of it, but I saw a post from a friend of mine, a Motorway school in Sturges, and now they've got over 100 kids. They're spread all over the area. My friend particularly lives 38 kilometres away from the school, and already they've made up packs. They had them delivered well before they went into isolation yesterday, and they think that's just amazing response from everyone at the school and around the community, looking at the big coaching and everything, to make sure everything was ready to go. Because, you know, it is hard for people in rural areas who don't have the connectivity that urban schools have. So this is just a way they've managed to work around the teams that have obviously been working around the clock to try and get these packs in place and actually physically delivered. So for people like Amy who don't have Wi-Fi, yeah, it's a really, really crucial thing for them to be able to entertain their children and keep them learning over this period as well.
Yeah, absolutely. Now, short rodeo season says in Motorway, what season of the Cowboys claim titles?
Yeah, and this is really interesting because for the first time in just 33 points. So it's been a really intense season this year, and that was the all-rounder season. There were 8 contestants in each of the 8 rodeo